Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health. Today we're going to talk about the difference between telehealth and telemedicine. Sort of an interesting issue of semantics. So telehealth is really an overarching term that refers to sort of new ways of communicating within the healthcare arena. So it might be like doctor-to-doctor communication, whether it be by video conference or by some other means over the internet. It could be remote patient monitoring, where the patient might be at home or at another clinic site, and the clinician who's monitoring the device or the data is in a different setting, whether it's the hospital or their own clinic. It also involves just patient information over the internet, whether it be through an app or on-demand video. So that's telehealth. Now let's contrast that with telemedicine, which is a virtual clinical visit between a healthcare provider, like a doctor or nurse, and a patient. So it's meant for like diagnosis and treatment. In other words, it's virtual care. So telemedicine is virtual care of the patient. Now, another important distinction is where you get your telemedicine from. So telemedicine from a traditional fee-for-service system like the local hospital system or the local physician group that's associated with that hospital system, they often use telemedicine and primary care as a means to generate more referrals to their specialists, to generate more tests and more procedures and more volume to their hospital. It's one of their strategies. It's why they do it. Now, the other model, which is what First Stop Health does, is the capitated model, where there's a fixed fee and there's none of that perverse incentive to demand and create more and more services based upon telemedicine. Now, it doesn't have to be from First Stop Health. It could be from a direct primary care clinic. It could be from an on-site or a near-site clinic. But if they're delivering virtual care, then that can be considered sort of capitated virtual telemedicine as well. So it's an important distinction, and I wanted to share that with you today. Both telemedicine versus telehealth, and then also whether you're receiving it fee for service or through a capitated model. And that's my point for today. Thanks so much for watching.